All right, welcome everybody. Do we need to start with a roll call?
Yes.
Ismael Rivera, District 1.
Steve Hill, District 3.
King, District 1.
Nicola Day O'Brien, District 3.
Joel Wallen, District 5.
Toyina Kimberly.
And Toyin, what district are you? 2.
District 2.
Thank you. All right, and then any comments on the minutes? Ishmael, thanks for catching the date on that.
You're welcome.
Do you have a motion to approve them?
I move to approve the minutes of February 11, 2026.
I second.
And do we do a roll call for this too?
Oh, it should be the 25th.
Oh, no.
Sorry,
Oh, okay. So the 20. Did I?
Yeah.
Am I
February
looking at the
25th.
earlier one again? I'm looking at the
I'm
earlier
sorry.
one.
That's my bad.
No, that's me looking at an older email. I move to approve the minutes of February 25th, 2026.
I will second.
Thank you, Stephen. All in favor?
I
Aye.
All right. Opposed? Abstained? All right, the minutes have passed. Could somebody just give me like the real quick overview of where we are at? Ismael, thank you for your email, and obviously Greg, it was good talking to you the other day. But just, I know that there was discussion about the scoring sheet and then review of a number of applications.
So today we're supposed to review the final score sheets that were edited during our meeting. We had plenty of discussions around that. And then we were supposed to review the first, I think, 10 to 12 proposals if we were able to get through them today, starting with proposal number 2. And we also discussed keeping the each proposal between 15 to 20 minutes max. I don't know if I missed anything, Greg.
No, I think that's a pretty good overview. I mean, just Joel, I don't know if you were you were in the committee last year, but like some of the things came up around the scoring rubric, and we kind of tried to Lena and I sort of combed the notes from the past and couldn't really find many things. So I don't know if we missed them or what, but we basically started over with a whole new discussion about the scoring rubric and things that could be updated. And admittedly, there were some artifacts in there from prior iterations of the scoring that had sort of like references to things that were confusing. And, so we just took a step back and looked at the whole thing and came up with a new scoring instrument. It's not that far of a departure from the previous one, but I think it works a lot better. It's a little less clunky. And so that's the background on that as to how we where we left off with that.
Yeah. And I did quickly check the tool earlier today. There's the only minor change that needs to happen is the scoring and the totaling of the scoring.
You mean in terms of the fillable PDF?
That's correct. Yeah. So
Okay.
Once you do the totals, let's say on the point awarded, it doesn't automatically add the total of points awarded.
Okay. Yeah, we could fix that. It's
Now
really
it looks like it's just got fixed.
Okay.
Yeah. Thank you, Lena.
I do have a question. I don't know if this is discussed or not. If I missed it, my apologies. But is the minimum score that we're allowing a 0 or a 1?
I believe if you go back to the guide, we're allowing 0 on most things. I'm not sure if we're allowing 0 on all of them, but or actually, no, it looks like maybe one.
It's between
Yeah.
1 and above.
I had wanted to do away with zeros, but I could have swore when I was looking at the guide, I saw references to zero.
I
But I
think it's
guess,
just for the discretionary points. You
oh,
can
okay,
award
yeah.
zero.
That's where I saw it. Yeah. So, yeah, there's some definite leeway there for the discretionary to actually give a zero. But I think when I originally developed this many years ago, we had, I mean, part of my reason of developing this honestly is because some people were scoring entire applications zero. And so it was one of these things where I don't feel like any of them were ever that bad, and sometimes it wasn't even based on anything kind of, in my mind, at least rational. So that was part of the genesis for coming up with this concept of a guide and a scoring application. But again, I do want to emphasize it's a guide. So I think most of the committees in the past, committee members have appreciated this. But as I even changed some of the language on the scoring instrument to say sample, when it refers to the different sections of the RFP that you refer to. So in other words, use your own discretion. But these are examples, I should say examples of relevant PDF content on those 2 columns that have the different sections there. So Joel, do you want me to just segue into kind of going over this real quick?
Yes, please.
Okay. All right. So Lena and her excellent technical skills with computers and whatnot was able to kind of integrate this all into one and quickly on the fly, obviously adjust the fillable aspect of it. But so I appreciate that because I know that was one of the things that we had tossed around was could we have 2 different ones? I think it works better functionally to just have it all on one sheet. And there won't be extra forms that you'd have to fill out and potentially extra confusion too. So you see here that both the services and the facilities, if you look at the second, the 2 columns that are second to last there, each one is relevant to each sort of application you may be looking at. So it's kind of like a utility player is a score sheet in the sense that you can use the same one for both topical areas. So the first, Lena, is there any way you can kind of blow that up just a little bit? I could read it, but for me, it's still a vision test to kind of, okay, thank you. All right. So you'll see that on the left, you have the criteria 1 through 7. And then the sections, the big thematic sections that we're kind of scoring on. One of the things that there was a ton of discussion around was this number 2. Because there was a community need reference that people, I think, on the committee didn't fully understand, perhaps because it was referring back to the 5-year plan community needs. And then there was another one that was kind of referring to the community needs that we have ascertained from consulting the community through our community needs assessments that we usually do once a year, sometimes once every 2 years. So we kind of referred to that more as community needs that are more like prioritized or whatever, but we changed some of that language. So bottom line is there's 3 kind of prisms to look at it. And the other one that one of the committee members had mentioned during the prior meeting was that question 2 itself in the RFP kind of gets at community need too. So what we did is we nested all 3 of those aspects and gave them 3 points apiece, adding up to a total of 9 as it relates back to community need. So first of all, I don't think I need to kind of go over the first one, which is proposal narrative that much. I think that's fairly straightforward, and any content in the RFP is addressed by that. But I'm speaking now of the second one, which is proposal addresses a community need. So the first one, again, is addressing the 5-year consolidated plan and whether or not they've identified something in there. And we can refer back to the guide here in a minute, but I'll just go over these on the surface level right now. But for B, that pertains more to the question put to the applicant about community needs. So that may be their own definition or their own sort of way they're viewing what a community need is that Worcester has right now and how their program is addressing it. And then the third one is the community priority, which again is stuff that's further identified through like public meetings, and then we rank order them. So as I was explaining in the prior meeting, when I first started working for the city of Worcester, the big massive issue in community development was foreclosures, because everybody was still trying to dig their way in, blighted properties related to that and all the other issues associated with that. That's because we were digging our way out of the Great Recession still. Now you fast forward all these years later, and in between there was other sort of pet issues or things that became more prominent in terms of like priorities for the city. Now you're going to have things like homelessness, mental health crises, things like that as being more at the forefront. And foreclosures may still be on there, for instance, but it's lower on the list. So this allows for us to prioritize more current needs that may or may not be in the 5-year consolidated plan. Usually they are, but they're not necessarily ranked in the 5-year in terms of what's truly something that we're looking at like today versus last year or 3 years ago. So hopefully that makes sense. And this will enable people to kind of look at those different attributes of community needs and add up to 9 based on what the guide says. And then of course, proposal has relevant, clear outcomes and measurements. That's pretty straightforward as well. And that refers back to questions number 7 and 9 in the RFP. And then if it's the facility application you're looking at, it would be question 4. I think the facility only has like 4 or 5 questions total. And then there's an attachment A, and other sort of metrics you can use, including whether or not the estimates are provided and whether or not there's a scope of work in there. So all of that kind of relates back to whether or not there's clear, relevant outcomes or measurements, which again, those concepts are really more like public service, social service type concepts, but that's how we apply them to the facilities too, is by looking at that particular content of the RFP. The 4th one is project readiness or delivery plans are reasonable and sound. There's a little bit of overlap between 3 and 4, admittedly, but the questions that we kind of hone in are questions 8, 10, and 11 on the facilities, and then number 4 in attachment A for the facilities. And that's where there's a little bit more overlap, is really in the facility section on those 2 sections. And then organization has strong experience serving relevant communities. There are some explicit questions that kind of get to that to some extent, staffing capacity, who's on the staff, that kind of stuff. That would be questions 1 and 3 in the service RFP, and then question 1 would hopefully address that in their overview that they give as part of the facilities applications. And then the budget was a little more straightforward. That would be question 5, and then the program budget itself for the services. And then we also have section 5, project budget, and attachment B as it relates to the facilities. So as you can see, each one of them has something relevant. But again, as it says, these are examples. So you can look at everything and draw your assessment. You don't have to just look at those particular sections per se. This is more of a tool to help you. And then, as I mentioned, I want to say like 3 generations back in this committee, there was a lot of kind of grumbling about, well, we don't really, we went from one extreme of like having no rubric to like maybe the rubric is too canonical or whatever, to where you can't even like escape it, and so people were like, well, I want to have my own sort of opportunity to rank something that might be just based on my own opinion or my own feelings about something, and that's what the discretionary committee member points are. And we only have 2 for that because I don't think it should be a huge factor, but it could still potentially make a difference. And then I don't believe I need to go blow by blow through the guide, but why don't you bring that up, because that would take a long time. If you want to bring that up, Lena, I can kind of like maybe highlight a few sections. So I guess some of the main areas that changed included the number 3 project program proposal. And so what we did here is we broke out 2 different sections, whether it's services or facilities, where in a lot of the other cases, you can simply just use what's in that column because it applies to both. You can glean information from both applications just using the guidances in the single column. And then the one with the two is kind of a little more nuanced towards whether you're looking at facilities or services. Now we shaved a point off. Lena, help me out here. Going off memory here. I think that was off the discretionary points, I believe, right? But
Yeah,
that,
so the point total used to be out of 55, and then there were two changes to that. One is taking out the community needs bonus points and incorporating that into question 2.
yeah,
And then the other was to take off 1 point from discretionary points because the section was like, I agree, I strongly agree, I very strongly agree, or something along those lines, as opposed to just
yeah.
kind of streamlining that.
Yeah, so it's twofold because there wasn't much distinction between, levels of agreeing or not agreeing. And then also we don't want to have that be a real, a real sort of game changer in terms of the overall scoring, but rather just kind of slightly influenced because again, it's kind of personal preference or opinion, or how you might feel about that organization or that part of town or that application or whatever. So those are kind of the changes. I don't know if anybody's had a chance to kind of comb through it. If there's anything, obviously we're not perfect, as you can tell. We make some mistakes here and there. So if there's something that jumps out at you as like, oh, we overlooked something or we made a mistake on some of the scoring numbers or something in the guide, just please let us know and we'll update it. I think that's probably the best tack or the best approach rather than just because I don't know that everybody got a chance to already kind of go into the weeds on this yet. And that way I would think by next meeting we could maybe say this is the fully finalized kind of blessed version of the scoring in the guide that we're going to go forward with so people can actually start using it. And
Sounds
that
good
would-
to me.
Yeah, that
So-
works for me.
I did spend some time look through. Thank you so much for incorporating everything we say and streamline and consolidate some points. This make a lot of sense to me as a new member, and I love guides because there's a breakdown, not to say 9 points, actually give you 1, 2, 3, what you're looking for. It's very helpful for me. Thank you. I can see you spend a lot of time and work on this. Really appreciate this.
Well, thank you. Like I said, I was kind of honestly, I should have revisited the prior version a little closer. I didn't realize there were some things that were antiquated and kind of need to be updated. And then when we revisited the whole thing, I was like, oh, this works nicely the way it's set up. So hopefully you'll find it useful.
Any other comments or questions?
No questions. I think we should make a motion to accept the scoring tool and move on to the next agenda.
Thank you. Would anybody like to make a motion? I'll make a motion. Can we get a second?
I will second.
Thank you. All in favor?
I
Aye.
Aye.
Opposed? Abstained? Motion passes to accept this as the scoring rubric.
And I
Alright.
will send out the copy after this meeting that correctly calculates totals, as Izzy pointed out that there is an issue with that before.
All right, we ready to move into the applications?
Let's roll.
Let's roll. So for those that join, we're not part of the pre-meeting conversation. Ishmael has agreed to, or sorry, Lena now has agreed to keep a timer just to be able to keep us on track. My understanding is the discussion from last week was that we would at most spend 20 minutes per application. Ideally, we're really discussing, we're not having somebody that's just slow walking us through the application. It's really additional questions or something that maybe stood out to you. My other encouragement is, I don't necessarily think that everyone needs to comment on every single application. And if someone's made a comment then that you agree with, then hopefully there's not a lot of repeating, and that's not in any way to kind of stifle conversation or dialogue. It's just in order to looking at it's a thick binder, and so that we are not having to stay till 9:30 multiple Wednesdays in any given month. Does that all sound good?
Very good.
All right, we can again. I don't know exactly how the conversation happened last week, but right now we are on application number 2, Boys and Girls Club. This is for the Find Their Futures, the teen program, and they're looking for just under 50,000.
I thought it was a great application. Again, I thought they had measurable outputs and outcomes. I think the fact that they pointed out that 93% of these kids receive no services from other agencies, 100% of members employed outside of the club have received positive evaluations, none have been terminated, and no funds are available elsewhere for driver's license subsidies. I thought those were like the 3 standout statements of the application. I thought it justified the program. The program's free with membership. Yeah. And the fact that like some of the cost would go to the driver's ed, classroom education, the youth stipends, and the lifeguard supplies, and not just salaries and benefits, which are important with unrestricted funds. I thought it was strong.
Are there other thoughts or comments?
I mean, the only thing I found was that within the measurable program outputs and outcomes, they have 100 teens versus 150 teens. But other than that, it was a strong proposal.
One of the
When
things
it
I really
comes,
liked was that they have an opportunity. They have this annual membership fee, which is really not supposed to be a financial barrier, just a way to kind of get people to make commitments. But that you had the opportunity to do volunteer work as a way to pay for that. I think that's a really cool, equitable model.
one thing that I will note that was quite intriguing to me is that throughout the participants, 100% always historically meet all the requirements, and it's kind of hard to understand like how amazing that program is and why it's not being looked at further and sort of like duplicated if that's the case, given the fact that many, at least data shows that many people of color and who historically are marginalized are less successful. So that was just sort of like something that caught my eye as I was reading it. And budget wise, it seems cost effective.
All right. Any other thoughts or comments? I don't want to rush, nor do I want to belabor. All right, so we can move on to application number 3, Central for their emergency food pantry, requesting $55,000.
So this one, had a couple of areas. I mean, the area that I felt could have been improved drastically was under measurable program outputs and outcomes. It doesn't really articulate, or at least, talks about sort of like number of unhoused served, number of individuals, so clients served, number of first-time clients being utilized, or number of percentage of seniors, or like number of emergency food boxes, or meals provided. I think it could be a little more flushed out. In terms of operations, like how many volunteers or hours of volunteer work occurs, it would be another nice outcomes to measure. And then in terms of outputs, like number of referrals referred to SNAP or nutritional materials distributed. I think they can do a little better with these funds, but that's one area that I did pick up. On question 3, the roles and duties of the boards weren't provided. Besides the pounds, there wasn't really no clear previous results for ongoing program that's funded, or results from the satisfactional surveys that they speak in several applications previously to this one as well. And in terms of organizational financial sustainability, that's one area that they also don't highlight. Other organizations that utilizing to support the funds. And most of it goes to direct care services versus food, which was another thing I saw in the application. But other than that, I don't have any other things to comment. It's a needed service in Worcester. So
Central has had a case management program for a number of years, and most of the places with food pantries often will discover needs and refer people to case management. They don't mention that here at all, which is something. I mean, somebody comes in, obviously, if they don't have food stamps, you can help them out or whatever. But there are plenty of other services they could do. So I don't know if they mentioned any case management at all in the application. I didn't see that.
yeah, they do mention that as a service category that they provide. So that's why I thought that the measurable and outcomes could have been improved to reflect some of that.
I agree. Yep.
Yeah, especially since I thought this application was really the emergency food pantry, or the food pantry just centric, which they may just as a broader organization do case management. And maybe this application is just zoomed in specifically to help the food pantry.
And I would think that it's the latter, because they actually had an application. I don't know if people recall last year for
Yes.
case management specifically.
Mm-hmm.
And then they didn't accept their award or didn't want to, because they wanted it to go on to the food pantry. But since we had already reviewed it through you guys and through the city manager and already submitted it or had a draft action plan ready to go to HUD, it wasn't really something we could backtrack on and then suddenly take money that was intended for another activity and apply to that. So that was kind of the backstory to that. And it looks like this year they just didn't even submit one at all for case management.
Right.
I just have a couple quick questions. It's maybe part of a learning curve for me. One thing is they ask 58% and the CDBG grant support program. That doesn't sound sustainable program to me. And another thing, it provide any individual 2 to 3 day nutrition. How much 2 to 3 days nutrition make an impact? That part again, I don't have knowledge of that. Maybe somebody. This is just my question. Maybe you know.
So I just have a few comments just from my experience having staff that run a food pantry. One of the challenges, part of the reason why there's obviously a supply and demand component to distributing food, but the other challenge with distributing food is a lot of people walk to the food pantries. So sometimes you literally are giving them basically as much food as they're able to carry back to their house. And if that's, for some people carrying 50 pounds worth of food, which could potentially, be less than a week's worth of food, depending on how many people are in your household. Carrying 50 pounds of food a few blocks can really actually be a challenge for people. I do think, I think it is pretty common in the food insecurity space to not spend money or not spend much money on purchasing food itself and being able to source that food from kind of free options. So that's not a surprise to me that they have that as a model.
Well, I know their food pantry's always been based in the basement of their facility, and I just want to make sure that they have handicap access for people who can't manage to go down the stairs and up the stairs. So I believe in the past what they do, they used to bring the bags up, but I just want to ensure that they're still doing that.
To the comment that was made earlier about the 58%, Ping, were you saying that? Did you say that you thought that was unsustainable for a program?
From my experience with the
Yeah.
grants
Yeah.
money, yeah.
Okay.
Is it like
Yeah.
a long-term or short-term solution? Short-term, that's okay. If somebody doing this for so long, to me, it's not sustainable.
Yeah.
From my experience, but I have a limited experience. So
I will say year over year, and I unfortunately I don't have the data point in front of me, so I can't compare it right now to the prior year. But typically, I believe that 58% has been even higher. So at one point, it was almost 100% for many years. So I tend to agree that it's kind of on the high end, but it's also actually less than it was in the past. So
Are we allowed to look year over year at applications? Because I do have last year's binder in front of me.
yeah, what was it last year?
So last year it was 11%, the CDBG funds, but they included food purchases in their budget sheet in attachment A. And I think this time they're not including food purchases, or they may have. Well, maybe it's a lot because food purchases, WCFB purchases, donated food, it's $1,500. Last year it was $150,000. So I don't know, maybe something in the table is off. Or maybe they got a lot of in-kind donations. So maybe a year over year is not great to be looking at for this organization.
They do show a lot of donations and private grants in the other funding this year, but
Mhm.
I don't know how that compares to last year. But
Lena, you screen sharing something?
I think it's our timer. Oh,
No, sorry, this is the application from last year, just for folks who don't have it available to them. I'm not sure what page you were looking at, but
I was looking at attachment A. I don't know if it's fair to look at applications from last year
Yeah,
either. This is why I'm like,
I don't think it's a good idea because we'll spend way too much time
right.
going between applications. And
Yeah,
what
but
we really need to score is our current application process.
the food purchases last year was like almost $150,000, and this year it's $1,500. So it could be off, but I don't know.
So last year looked like 38,000 from the CDBG, right, Lena?
38,896.
Yeah. But
Yeah, she's highlighting basically the total food purchase as a whole. How much do they actually purchase per year? And that's almost 150,000. This year is drastically decreased, which could be either an error, and if it's real, then obviously that there's a problem in terms of like how do they get in their food? But I think that's
so
really more for Greg to go back and take a look at that and maybe clarify like why the disparity between the food purchase from last year versus this year and how they're coping with it.
So remember, you guys do have the ability to agree upon a question or questions on certain applications that we can circle back to the applicant on, especially in lieu of the fact that we no longer do the public presentations of the applicants are no longer required to do a presentation before you all. So,
Mhm.
so if that's something you want us to circle back with them, we certainly can.
That might
I
be
think
the
that's great.
question, the
Yeah.
discrepancy. And to answer, I guess, Ping's question of last year, it was 38,896 that they requested. The cost per client is still the same. So I'm imagining last year compared to this year is $50.50. So I imagine they're requesting $55,000 based on inflation, just general inflation. I know my grocery bills have gotten a lot more expensive.
And I will say that is one thing that Centro has done that I've noticed over the years. They've kept their cost per unit, fairly stable.
I think it's worth asking them why. I mean, it's almost like they just forgot a few zeros this year. I mean, the numbers are so off, but so closely off. Yes, I think that's my recommendation would be that as a committee, we ask the staff to follow up with them.
We can do that.
And I would, clarify like if that is the case, how are they I guess overcoming, or how are they supplementing those food items, because that's what technically we're paying for the labor, and they were having the food items being purchased.
Yeah, it's interesting because they say food purchases Worcester County Food Bank purchases, which is an interesting way to measure. Like, I'm not saying it's wrong or right, but if you're getting the food from the food bank for free, but the food bank is purchasing the food, how do you even know exactly what the food bank is purchasing?
Right.
Truckloads full of food at, and then why are you accounting that? Yeah, why? Like, you could if all you did was just say food purchases or food donations, and then you're valuing the food donation, the food donated per pounds. But if a church purchased food, you would just value it by the value of food that you're receiving, not the value that the church purchased the food for. I don't know if I'm being clear or not.
No, you are, because in one place they indicate that it's private grants, donations, and coming from FEMA, right? So if that's where it's coming from, they should specifically indicate by category where that's coming from, and or at least the funds. And if they are calculating by the total donated food from, let's say, like from the food bank, then they technically shouldn't be calculating that within their sort of budget. They probably could add some language into the narrative where they suggest, for example, we're receiving this total, of food per, whatever it is from this organization, but it's not like they're managing those funds and purchasing it themselves.
Yeah. After all the questions are done on the application, it goes to that section 5 and that budget explanation. They do say the total operating cost is a little over $94,000. And the remaining $39,180 is going to be covered through other funding sources, including food donations. So, yeah, I'm wondering if they're including in-kind donations or not in the grand scope, or if they just mentioned it there just for funsies. But yeah, I agree with Izzy. It's not very clear.
Other than that, I don't think I have any other comments. I don't know if anyone else has any. We got 2 minutes.
And yeah, 498,000 pounds of food in calendar year 2025 is extremely robust. So they're getting it from somewhere. And maybe I agree.
That's an insane. That's an insane amount of food. If they're dedicating one part-time person to that, then they've really done a good job mobilizing the volunteer labor.
Mm-hmm. And I think it'd be important to follow up with Steve's question if people with accessibility needs are getting the food in the same, if they're getting the food brought upstairs to them. There's no speed bumps to those with accessibility needs.
Any other comments on Central? All right, moving on to application number 4, Dismas House. This is their bar none program, asking for $10,000.
I like this application. Excuse me. I like this application a lot. They were just very to the point in reference to this is what we're going to do with the money. These are the amount of people that we're going to assist. And it seems more realistic, maybe because it was just like, we're helping 8 clients. This is what's going to happen. This is the amount of money that we need. I feel like maybe they could have even asked for a little bit more. But yeah, I liked it. There's the other stuff there too, where they kind of mentioned their board members and like some of the other stuff that they've done in reference to like client tracking and outcomes and numbers served. So I really liked it.
I
Yeah,
know we're
it's kind of
talking. You
I
go
was just gonna
ahead,
say
Joel.
that's kind of been a fan favorite or a favorite of ours, if I remember
Oh,
correctly.
really? Okay.
Yes, it was.
Okay, I didn't know that. I was like, oh, I like this application. Okay, cool.
You're doing a good job reading the room.
Okay.
Yeah. The only thing that I picked up, and that was just really like a minor thing, which I'm it's on question number 9. They're missing something there. I mean, I'm assuming that they're probably still thinking of serving between 600 to 800 individuals rather than 0 to 800. So I think that's just a typo. But I know last year they did 600 to 700, I think it was. Um, and then the last thing was the leveraging, program leveraging. There's really nothing there in terms of dates or funding or stuff like that. But other than that, it's a great proposal. There's nothing really.
Yeah, I like that Bar None charges no fees. I like how they say in the event of limited funding, Bar None will not terminate case representation. The only thing that I noticed, yeah, they mention other private funding. No real leverage of fees on that graph. As far as like the project program leverage, that's fine. But we're talking about like $2,000 out of however many million, but it is an adding error. They want to serve 8 clients at $1,000 per client, and that's $8,000, and they're requesting 10. That's the only thing where I'm like, well, then
Yes,
are you
I know.
serving 10 clients? Like, could they? Can we say, did you meant to say 10 clients, or is each client going to cost a little bit more than $1,000? But again, it's $2,125. So that was my only minor quibble.
Yeah, and last year they had the same situation.
I have a question. To me, maybe again, it's a background I'm not familiar with. And they only serve 8 people among so many needs in the city. Is that what I'm reading? So
Yeah, this is
how do they identify those 8 people? Maybe I missed that part.
They only serve a very small niche of people at Dismas House. So I'm assuming from what I read is that they're just basically providing legal support to those individuals within their programs. So
Okay.
they don't have a huge turnover that much. I mean, I think they get like new members every 6 months or something like that, and they're there quite often. It's a pretty good, stable program.
Okay. Another question, maybe just the words they are using confuse me a little bit. Question 3, Bar None program is sponsored, overseen. When I read sponsored, I couldn't stop. I said, which organization manages this program, provided this program? But based on what you guys saying, I read again, they provide a service. Is that correct?
Yes.
But
yes.
why they use the word sponsor? Maybe that confused me a little bit. I thought they are overseeing party for this program.
I think
So
they're using that
some,
word.
yeah.
My understanding is they're using that word interchangeably.
Okay.
And they're also using a different legal attorney to provide such services within Dismas House. I think that's
Okay.
where the sponsorship comes out.
Okay.
It's not
Okay.
like
That makes
Disma
sense.
has internal legal attorneys. They have to use a different company to be able to provide such services. So I think that's why they use the word sponsor.
Okay. That makes sense because some nonprofit, they do need a sponsor from another nonprofit. So that's
Yes.
why it kind of confused me. I say, which one applying for this? Good. So I have a lot of questions. Sorry for
No worries.
Oh,
asking
that's
so
good,
many questions.
Pings.
Yeah.
Okay, we're doing good with time. Any other
Yeah,
questions?
any other thoughts about Dismas House and bar none? Okay, on to where we at? 5, Family Health Center. This is their emergency dental services. 20,000, asking for $20,000.
So this was another excellent proposal. I like the fact that they're specifically targeting individuals that are uninsured or unable to pay based on the demographics. They're looking to serve 80 people, which I think is great. I think it was last year they also did a great proposal. One thing that I did see in the budget summary projection, and I don't know, I mean, they're receiving over $2 million, was a huge difference from last year. So I don't know how, I mean, if that's a typo, if they really do receive that. But I don't recall that last year. The
Where are you
leveraging.
looking?
Yeah,
Yeah, on section 5, projected funding and budget summary.
Oh,
I mean if I remember right, I mean last year wasn't even. I mean they didn't even have 100,000.
no,
Such a huge.
because then if you look at their budget, the last page, that's completely different.
Yeah, so I don't know if that's a mistake or what, but to me, if I said, wow, if you just got $2 million, you don't need the $20,000.
maybe it's Family Health Center of Worcester overall is getting, yeah, I don't know. Maybe we should ask clarification on that.
I think it's probably the latter. Maybe not the
Yeah.
whole organization, but that part of the organization that receives that kind of, it does those
Yeah.
kind of services.
Yeah.
Okay.
So it's just something that just caught my eye as soon as I saw
Yeah.
it. And then the leveraging, they don't really have anything on the leveraging program leverage on the tables. But they do speak about it in the narrative somewhere. So I guess overall that's fine with me.
This could be an application thing, like an application error and not an organizational error. Under their project implementation schedule, it looks like it's only fourth quarter and first quarter. I don't know if it's not a year-round thing, if they only operate it between April and September of each year, or if it's a year-round thing.
Mm-hmm.
Or is it? I'm curious if I don't know. I'm just speculating. Is it year round, but then this funding covers that period?
Ooh, maybe.
Just with this, with them saying that this is gonna cover about 50% of the dentist.
Yeah.
If,
Okay.
if they're saying the dentist is gonna work year rounds, but I don't know.
So I think people misinterpret this table sometimes. And that's probably just, I would chalk it up to that in terms of, I've had people like, do I put an X in every block or do I put it just at the beginning and the end? It kind of implies, I think the way we wrote it, that when the activity begins and when it ends. But these are some good questions. I don't know. I mean, I would maybe advise you all to hone in on one that you really, if you want to ask, that would really kind of like make a difference for this particular application.
I mean, I think clarity around that 2 million
Yeah, I think it's the $2 million question would be the $2 million question.
Yeah.
Well played. All right, other comments about this?
It is a great service they provide, and it's very hard to find dental service and a lot of insurance, even Mass Health. I don't think they cover dental, and dental hygiene is so important. It's needed. I really think they did a good job for the application. Yeah, for the activity, this service should be all year long. And if they only mark a first quarter, last quarter, I think we need a clarification for that. It's good for them, for us to understand.
All right, should we move on to the second application from them?
Yeah, that sounds good.
Yes.
Okay, this is then again still from Family Health Center. This is for their healthcare for homeless families. Again, asking for 20,000. And Ishmael, to the point that you brought up, it looks similar that what they're providing in Section 5 doesn't line up with their total budget on the back page.
What was interesting too, is that they went from 80 clients to 30 families from last year. So that was quite a drop. And I wish they had talked about it a little bit in the proposal, but it's not really highlighted there. On question number 2, they don't really talk about 2024 to 2025 data. They sort of just reference the previous year's data in there. And then on question number 7, measurable program outputs and outcomes. Again, I think it just being a little more sort of clear around the examples that they could be utilizing. So for example, 35% of the enrolled clients will secure housing within the next 120 days of intake or something like that, or 60% of the clients lacking documentation will receive like government IDs, for example, because many of them don't have it. So I just feel like a program that just really hones in with people who are experiencing homelessness. They're not really addressing the core issues that people have, like the lack of government ID to be able to access support, that sort of thing. I think that I would like to see that more reflected in the work that they do. But again, it's 20,000, so like they're not asking for a lot, but it is well needed in the community.
I noticed what Ismail noticed about it will be good idea provide the last year, fiscal year, an improvement or whatever they did. But the data given is 2023. And also they say family. They did clarify family mean 1 to how many people. But in the number now, question 7, then they say at least 30 individuals. So which is which? Is it 30 families or 30 individuals? It's not clear.
That
Anyone else? Yeah.
yeah. The only thing I wanted to point out, I think other people had very good points. This stuck out to me under their consolidated plan consistency, that the family health, they just always abbreviate it. The Family Health Center of Worcester doesn't duplicate other services, and it's the only program that offers comprehensive access to healthcare for unhoused family groups of all ages and pregnant people. So I think it is a large need. Um, but clarifying, I guess, how many people this would actually help. I think it's just 30 low to moderate income parents slash heads of families is what it is, or at least that's what the blurb at the front says. So I don't think I have a question about that.
Any other comments? Okay, so this is moving on to number 7, the first of a handful of applications from Friendly House. This is for their basic social services and case management, asking for just under 114,000. Anybody have any thoughts about this?
It's similar to what we
I
talked
just
about
had
last year. I
to,
mean, they do have, measurable outcomes and stuff like that. But again, for a program that's been in existence for a while, I just don't understand like how they have not talked about the core data and measurable outcomes that can actually be sustained in this program. When it talks, when it indicates in terms of intake, individual service plans, how many people completed or properly housed, or how many people were referred to a particular service program and successfully attended that program. I just feel like it's something that should be measured correctly and supported, because you can't really feel the outcomes presented here to that extent. I mean, like to me, telling me like I saw 150 people doesn't really say much. I mean, I see 150 people almost every week myself, but what for? What did I do with them? What did they achieve throughout that week or year? Other than that, it's a good proposal. They do amazing work in the community, and they do address the consolidated plan and the consistency. They do highlight those.
I mean, my comment is less about this application. It's just, I mean, to me, one of my decision making thought processes is, them having 4 applications put in, and that's I like, I love Friendly House, and I think they do phenomenal work. But that's that's a factor in this to me.
I'll sort of counter that, knowing that they've opened that Green Island Neighborhood Center. That's like a brand new thing. So maybe, but I understand having 4 applications, but they are expanding.
My understanding is it's the exact opposite. My understanding is
Really?
that they've closed that and they're no longer doing food out of there. And that my understanding is if they have a presence there at all, it's been reduced over the last 5 years rather than expand. I mean, they've consolidated all their food distribution out of the Green Island Neighborhood Center and out of Plumley Village.
Oh, well, thank you for clarifying that because I got a little tricked on that. I was
That's
like,
my
oh,
understanding. That's my understanding.
okay.
I don't know if anybody else has additional information.
Used to administer Green Island, and when they pulled back, Friendly House helped them out a little bit. So I don't know how much they're doing now.
But that was quite some time ago, right?
Uh,
That was so Swinnick's gone through a bunch of challenges. I mean, in terms of staffing and
budget.
financially, and so basically they kind of stepped in, and it's my understanding. Again, we can circle back with them and make sure that or figure out if this is still something they're doing. But they had stepped into that particular Green Island Neighborhood Center to kind of fill that void and to fill the gap that Swinnick was kind of leaving behind. My sense is it's kind of been a loss leader for them almost in terms of like, you know, they're not exactly like, I mean, they're basically in the red on that for serving that particular population in that particular area. But I don't know. I don't know what you're going off of. I can certainly circle back with Trish and ask, have you stopped? Are you implying that they're just doing solely food out of there? Is that what you were saying?
They're doing mostly food, but a little bit of case management.
Yeah.
Out of Green Islands?
Yes.
That's not my understanding.
Yeah,
Okay.
the application says they moved all food services to the Wall Street Neighborhood Center. And case management went to Green Island. But I thought the Green Island Neighborhood Center was a little bit, so I'm wrong, so I'm not going to talk about it, what I thought.
Well, I know the director, Friendly House's director of services, Josefina Velez, has her office there. And she's mainly case management, but it is confusing. They should be a little more specific.
Yeah, and they should be specific in terms of like what do they mean by case management, right? Like, are they doing intakes? Are they doing individual service plans with people to figure out what issues they might have or what supports they need? And are they referring people to communities that can support them? And are they connecting those members? I mean, to me, those are relevant outcome measures that I think should be in this application. I said that last year. I think it really does a disservice if we just continue to give money to people and assume that they are doing that work when it's not even reflected in the application process. That's just my 2 cents. And I think because I'm such an expert in case management and in integrated care, I pick that up so easily that it just frustrates me. But other than that, I mean,
I think that's what application 8 should be, and not so much application 7. Although I agree with you in principle. For better, for worse, case management has really been kind of, you know, one-off assistance, help some translate a document for somebody, hand them a bag of food. In some cases, we even count that as an outcome because there is some interaction beyond just that, but it's not what you may be referring to, which is more of like, let me do an intake form and assess where you're at right now and figure out over time how we can get you out of the situation that you're in, as opposed to let me solve your immediate, you know, urgent need right now, you know.
Right. And then I would change the name, right? Rather than naming it case management, it's like they're really what they're doing is supported referrals and navigation, you know, connecting people to social services. I mean, that's really what it is. And then you measure that differently. How many members, you know, were connected to services was provided with short-term navigation services, for example, would be another way of measuring it. I just think it's just good feedback to provide. Like if they're going to apply for multiple service category, then the more clearer, the better. So you won't have these debates on a regular basis with the same people about why are we providing funding for similar services that are already funded through another contract.
Well, they've been doing a lot of immigration services lately, which can be a time
Yes,
consuming.
absolutely. And to me, I would consider that intensive case management services,
Yes.
because I know they provide that, and they're working with RISE program out of the Main Street office. Actually, I think is I can't remember her name, but she does amazing work with those families. But are they in that short basic social services? I don't know.
I mean, I'm not in the industry, but it seems like you are, Ismail. So I would assume that, like, if I were running a case management organization, I would want to build up and beef up the capacity related to that, to the staffing capacity related to that, because I'm assuming that what we're calling intensive case management and is going to involve a lot more touch points than just, again, helping somebody as they walk through the door one day.
Absolutely. I would shift the model completely. Like, for example, where the 13,000 is, I would say that's a basic social service. So just a quick thing, boom, boom, out. Intensive case management is intensive labor, from doing intakes, assessing people's needs, connecting them to immigration attorneys, getting them, documentation, getting them to housing, all of that. That's intensive labor. Like, it's like,
but I guess,
it's interesting how they have it here. Go ahead.
so I think it's kind of almost a fungible set of services that's sort of like organic, where somebody comes in and I don't know, again, I'm not in the industry, but I suspect that I don't know that it's like, okay, this is our intensive case management area and this is the people you interact with for more basic services. Maybe it is that way, but I just feel like they take whoever comes through their doors, and then some of them, for whatever reason, they may end up, working more closely with over time.
Mm-hmm.
And you know what I'm saying? So it's like more organic and not so much like there's a particular path or triage where you're going this way and you're going that way. You're going to work with this particular person. You're going to work with that other person. I feel like it's just sort of materializes based on, in the short discussions I've had with people, including people who work here now who used to do case management, that's the sense I get, that some of them, they go out of the way, even in their personal time, to help people, move into a new apartment or, whatever. And that is more of almost like life coaching, multiple touch points. And obviously it's a lot more structured and scientific than that in terms of like you're doing an assessment on the front end. But I have a feeling that's kind of the way some of these organizations operate. It's like, oh, you come in my door for this. Well, here you go. But then maybe there's a discussion or other needs that are identified. And then maybe perhaps because of the time allotted at that particular moment, they latch on to that particular client a little bit more. And then it kind of evolves from there into more of a working relationship over time, as opposed to like a specific sort of, set of programs that are quote unquote intensive, for lack of a better term to call it. You know what I'm saying? But I mean, I don't know if that's a question that you feel strongly about. We can certainly put it back to them in terms of like, how do you make that distinction? What's involved in the two levels, and how do you decide which client goes one way versus the other?
Right. It's almost like having a triage or a member recruitment flow chart, right? Where someone comes in through your doors, and then what happens? What level of need do they have? Is it like immediate? Is it something that can be resolved right now or tomorrow? Or is it something that has long-term intensive labor or even medium labor, right? So like there's so many ways of doing it that I think they should have someone help them define that better, because I know the work they do and it's really not reflected here. So if it's reflected and they know how to manage this and they get the support now, they can leverage those funding elsewhere, because there is money for like that level of intensive case management that people need, specifically for immigrants and refugees and LGBT services that they're not accessing, but they're not going to access it with the way they are actually implementing the model, because I wouldn't do it if it were not because I know them and they do amazing work. I would grade it so low, but I know that they do amazing work.
Would having like definitive outputs help? Because right now it just says we're going to serve 902 households, but would it be like 902 households will be intake. X amount will be referred to intensive case management. X amount will receive notary services. There's an application down the line that really, and I can't remember which one. So there we go. But it's like 140 people are going to use our fax machine. 30 people are going to be prevented from getting evicted, and it just lays it out a lot better than we're going to serve 902 households.
Yeah, and then also the number of case management contacts, right, equals, purpose interactions in person or phone or field work, right? Like, because
Yeah.
all of that matters, when you're thinking about like the level of work that may go into a particular member and the type of services that you might be providing. And then as you're measuring, like people were properly housed because they needed housing, right? So that there are small little things that can easily be done that demonstrates the level of work and capacity that people are doing, whether that's intensive, moderate, or low.
Steve, beyond Josefina, like how deep is their staff capacity around the case management? Do you know right now? I know it's changed and you haven't been involved lately, but
They have people in and out, but one thing they do with the intensive case management is they say in here that whoever they're working with will receive the service that it could be housing because they have some shelters. Like I said, they're big in immigration now. I think specifically with people from Haiti are coming in to the center. And I know in the past, most of the other neighborhood centers would refer their clients or difficult clients to Friendly House because they didn't have the capacity. I mean, FINA's obviously the most knowledgeable. I don't know now, but they say in here that they have 6 case managers. So I don't know how long they've been there.
Right. So Stephen, if we look at the anticipated delivery outputs, right, where it talks about 41 unduplicated low to moderate individual will receive services, right? It says 1 intake assessment, service plans developed, direct family support, problem solving, information referrals. I mean, they name it, right? What they're gonna do and how they're gonna do it. Their biggest flaw is they're not talking about that in the measurable outputs and outcomes. So they learned to define it better. Now they just have to put it in a measurable way.
And it took us a while.
100% or 90% of the people will have an intake.
Yeah.
And so on and so forth. I mean, that's a really good outcome.
Right.
And
I mean, they used management, somebody would come in and like Greg said, that they would give them a food bag and that would be an outcome. But we said, no, it's got to be more than that. You can't just give them a specific thing like that. So I agree. They need to be more specific in the results.
Mm-hmm. I would at least like to see it as like an output. I got in my grant writing course, I got drilled in the head about outputs versus outcome. And outcome for like case management is very nebulous. It's a survey, you can't, it's not like you can track families for years and years and say like in 5 years, X amount of family will find permanent housing or like they'll have a mortgage or they'll have job placements. It's tough, especially if you're serving so many people, but outputs is at least something that, at least for this broader application, it really didn't.
No,
it just said we're serving 900 people. I would love to say, or 902 households. I would love to see 500 is going to walk away with a referral, 400 is walking away with a bag of emergency food. Like that to me is
or a percentage.
Yeah.
Yep. I would. Yep.
Well, the problem is we tried to stay away from referrals because there was no follow up, and then so you can refer somebody to Family Health for their dental program, but they didn't follow up, so we didn't know what the result was, and that's one of the problems. We try to stay away from referrals in terms of an outcome. But
well, I mean, technically there's different ways of measuring that. Like if someone has a memorandum of agreement where they have authorization to release of information, you can follow up on those referrals. So I think that's more of a systemic thing in terms of how people go about doing it and tracking it. But anyways, we're actually getting off track right now, right? And we only have 1 minute left. And I'm a keeper of time and I'm talking too much. So we probably should go into what? The intensive case management.
Yeah,
I love
mean,
the timing system.
I mean, we're staying on the friendly house topic, but is it okay if we move on to number 8?
Yes.
Okay. Intensive case management, as you just said, just under 14,000.
And again, that's another good proposal. And the only comment I have is similar to the previous comments in terms of the outcomes and outputs.
I did like how this program is going to be serving more cases than last year. I don't know if that's a metric of things being better or worse, but going from 36 to 41 cases, was nice.
Actually, wasn't it last year's 50 people?
We need to reset the time.
Yeah, so
Thank you.
yeah. So technically they went from 50 to 40. So they actually went down. They didn't increase it.
One of the things they don't mention about friendly
So-
houses, whenever you have like a fire or a huge disaster, and there's all weekend at night, the staff go there and they really try to take care of things. It's not a 9 to 5 job for them.
Any additional comments? Okay, and then moving on to number 9, still friendly house, 71,000 youth development program.
Okay, so those numbers were all over the place. So one place they indicate they're gonna serve 102 unduplicate. Then they have another place 75, then another place 74. So we just need clarity in terms of, again, there's not a big difference between one or another, but there is a big difference between 74 and 102. So you might want to clarify like the number of people that are going to be served under that one.
Yeah, for me, it added looking at the it sort of added up looking at the budget attachment and the youth programs activities and objectives, which is toward the end of the application. The grand total of unduplicated clients is 85 out of the cohort of 425. And then the numbers on the next page, it's 23 youth attending the summer camp, 18 youth maintaining attendance of 75% or greater in the after school program, then 23 youth in the youth hoops, and then 10 youth in the teen leadership development. And that added to 84, but I also haven't taken a math class in a while. So
yeah, and then
see.
on the activity plan, then they have 102 people. So all the numbers don't match across the board. So
yeah, that's true, because then they're like their whole program is the narrative says 300, but the budget says 425, as I just said. So where does a 300 come from? Yeah. So I guess what is the actual number? It sounds like CDBG funds is going to be 84 to 85, but what's the total program? Is it 300 or 425?
So do you want to put that question back to them?
Yes, I would recommend that.
I did know that this is some like childcare is a need that we referenced in that survey. At least it was last year. I gotta look
Mhm.
again this year, but so that it is a need. So I do
Yes.
like the idea of all of these youth getting help and the funds going to distinct programs. So I do think there's a need, but yeah, what what's the number we're actually serving here and how many students are actually in the program? Because yeah, now on the first page I see 493. So
Yeah, it's
Yeah.
all over.
yeah,
Yes,
Well,
I
one
don't
of
know
the
how that happened because it really it's huge discrepancies between the thing. But you know, if you look at the numbers, according to the number of funds, they should have at least 85 people. That's what they should come up with. I mean, I would
They,
have them even clean it up and send you a new version because it's so messy across the board. But that's me.
Steve, were you gonna say something?
I just said that they provide, one of the few agencies that provides transportation to and from for the summer programs.
That's right.
That's a huge need, so it's widely utilized.
Yeah.
Excellent. Yeah. Thank you for pointing these things out.
Yeah, well, I don't know if they put it in there, but I did monitor them for about 25 years, so.
further comments? Okay, moving on to
Oh, sorry.
yep.
I have a comments for 3 application from Friendly Health. I like a second and a third, more specific. I agree with everybody's point for the first one. Too general, kind of like a wrap up of service, but it doesn't provide enough data, you know. And yeah, output will be the easy data to generate. How do you keep track 900 clients? So how do you measure that? So too general in application, not a specific for measurement. That's my feedback. For next one, I'm going to let everybody know because I work for literacy volunteer before. I'm currently still volunteer for them. So I'm gonna now going to score this application.
Thank you.
Could you be more clear in terms of which one?
Literacy volunteer, is that 10?
Oh,
The upcoming
literacy
application.
volunteer program. Yeah, number 10.
Literacy volunteer, yeah, next
Okay, thank you.
application. I will.
All right, I just wanted clarity on that.
Yeah,
Thank you.
yeah.
Okay, so moving on to literacy volunteers of Worcester, $30,000. The request. Thoughts or comments, questions on this?
I like how they added a board member with fundraising experience, and I think you can tell by the narrative of this application.
Yes.
Yeah, there's an explanation. Oh, it's the first application I've seen that has an explanation beyond just identifying the consolidated plan need. Or at least it was a strong enough that I noticed it. Let's see, I liked how it was an adult education. I liked how they posted the actual like pay rates of what these funds are going for. The executive director, $35 an hour at 25 hours a week. I thought it was a really strong application. Yeah, it's a really interesting subset. It shows that there's a huge need. I was shocked that there's, which I shouldn't be shocked that there's persistent wait lists exceeding 400 people, at least in the Quincy Adult Community Learning Center. So it sounds like they know how to run a program.
And very clear measurable outcomes, number of classes offered, amount of students served in the classes, tracked by attendance and sheets, and so on and so forth. I was very pleased with it overall.
Oh, and it's an application that includes program materials, not just salaries, which I like
Mhm.
too.
Mhm.
Specifically, I think books and teaching material.
Yeah.
Right? Yes.
It's a very cost-effective model.
Agreed. Okay, additional comments? Okay. Moving on to Merrill Safe Haven.
And actually, that's where I stopped. I don't know if anyone stopped went in about that, but if you did, good for you.
You stopped before this application or after this application?
I read up to the 10 contracts.
Oh, got it. My understanding was it was 10 after the one that you all after ACE that you all reviewed last week.
But no, we can move on to another one. I'm fine with that because I have it right in front of me.
I've got it.
Do other people have thoughts? I mean, are we going to review this one now?
Can I ask a question about this one?
All right, we're reviewing it.
Well, I feel more comfortable. I don't have any. I can withhold all my comments, but
No.
what, or like nebulously, this is the first program I've seen generating CDBG program income, and I'm just wondering how that happens and what happens with that in general. Like, we don't necessarily have to discuss this application at all, but it's just when a program generates income, does it go back to you guys? Does it?
So
What?
programming, yeah, program income is kind of what it implies, where you're generating some sort of income off of, whether it's through fees or some other sort of ancillary costs um, or funds coming in as a result of the program. There's a threshold, and right off the top of my head, I don't know if Steve, if you remember it, I can't remember what it is because we rarely encounter program income. But there's a metric that it has to be above to be considered that, and typically most organizations don't get anywhere near that, at least in the public services arena. And we're also not supporting organizations, excuse me, generally that are charging, large fees or whatever for the services because, that kind of negates serving low to moderate income individuals. But
Yeah, I mean, I just saw the cost per client. I was dumbfounded by it. I mean, 43,000 per member, which doesn't add up to the total cost if they're going to serve for 12 members. Doesn't even add up.
I have a quick questions. One is the cost. How do they sustain this? Is there within the CDBG and the support category? Because again, it's a lot of things to me. It's caught my eyes. Another thing, this look to me is a new program that just started last year. Is that what they say here?
They are relatively new in Worcester.
Yeah. Do we
Yeah.
know this is more like a housing, provide a housing for those people? Do they have other grant for support this kind of program? Is this a service, public services? I'm not sure. So those are questions just come to my brain when I'm reading this, and the cost just
Yeah, this
I
doesn't
don't
make
see.
sense.
Yeah, it doesn't. Maybe there's other fund can support this. Are we taking care of something we should not take care? Maybe Greg, you know more than this.
sorry, what was that last part? Maybe what?
I say, is that something this funding should not support for housing? This is for house, yeah.
Well, this is a housing sort of oriented organization, but they're providing a service
Case-
that's servicing people that are aging out of the foster system. So it is a service. So, and I believe we funded it at least 1 year before, right? I think Lena, you were the monitor on that.
Yes, what we funded it as they were getting off the ground as part of the new applicant program. It was just at like I think exactly $10,000.
I'm
They
looking at-
also
I'm looking at
the
some- The
sorry.
budget summary doesn't make sense. They're saying
No.
300,000, $500,000, but it doesn't add up. I'd like to see their budget summary expanded a little bit or reviewed and sent to us.
So
If
Lena,
it-
can you expound a little bit more on what they did? I believe it was
Yes.
like Kate. Yeah, go ahead.
So it is a wraparound program, and they applied for a high cost of unit when they initially applied as well. The cost of unit that we decided on was for just a portion of the program, and that was closer to how we value other public services. I think it was just over $200. If you go to the facility, has residential components to it. It's really just a home, but the first floor is open during the day, so they do entertain case management services for also folks who are not housed in the building. And that includes access to like all the parts of the programs that they run during the day, which is like the group therapy and the other components of that kind of youth group living that they're doing out of there. If that provides any sort of clarification.
Yeah, I mean, I'm wondering why they're not looking for like DCF or the Executive Office of Housing and Livable Communities to support their initiatives. I mean, that's a high cost per member.
Well, the problem with DCF is that we used to do foster care, and once the kids reached 23, 24, a lot of funding was taken away, opportunities. So foster parents weren't able to do anything with them, and they were kind of on their own in terms of housing. They would just go into a program, like anybody.
Yeah, I
think
know
DC
that. Go ahead. No, I know that they have increased the youth age, and I think it's actually 24 or something like that, or probably perhaps even 25. I can't remember, but as long as they're going to school and they're having some type of educational component, DCF will support those programs. So they might want to look into that. But I do think it's way high for per member because what they're offering is technically the educational components, not necessarily. It doesn't indicate the housing livable piece, at least from what I read.
It is a wraparound program. They provide housing, and then they also set up a savings account for the individual. That person has a case manager assigned to them for 24 hours a day. They connect them to employment or continued education. And the kids I don't want to call them kids, they're adults, but they're in kind of an education program for group living as well. So it's pretty strictly run. Sort of like it's a transitional home. So there's a lot of rules. They all have their own little, I don't know, binders and like it's kind of like it's a group living experience for people who don't have that safety net of a family to teach them those skills.
Yeah. I mean, they might, AmeriSafe, I really like this application. I know it's a huge cost per client, but it's housing and it's 12 residential units going to 12 unduplicated residential youth, and they had 40 referrals last year. So it's not like the program's ever going to be in need. The organization that runs it, AmeriSafe Haven, does operate a state contracted facility, so
Okay.
it may be because the program is so new, they're working on getting DCF involved, or maybe it's just the need, the scope. DCF, it's like a blind spot to them. Yeah, it's tough because they can only serve 12 or 13 people, even though there's 40 referrals. But it is housing. It does help youth. Like Lena says, it's a wraparound program. There are outcomes that they list. And it doesn't just include, I mean, the mortgage is part of it in the budget. Oh, the mortgage is 33 grand of what CDBG would be, or what they're asking from CDBG, 33,600 out of 168,000. So they are, it's paying not just for the people, but the program itself too. I don't know. It's very holistic, but yeah, that's kind of the cost to house them. I don't know. It's steep, but it's not, because there's so many services getting integrated into these 12 individuals.
Mm.
Or I guess in our case, 2 individuals.
Yeah, it comes out to 8,300 per person. I don't know where they got the 43,000 per client.
Oh no, CDBG's only helping 2 out of the 12, so it would be
Oh,
40.
2.
Yeah, yeah. But it still doesn't quite add up to 100,000. It adds up to 87,050. But then Lena was saying that the program itself, like that's the
My
number per
God.
client, even though what they might be asking for is a bit higher.
I'll house them at my unit here. And I'll cut it by 75%. How's that, Nicole?
Yeah.
That's a
I mean,
lot.
it's
But I won't say more.
I know. I just can't imagine being like a foster kid who's like 18, who's
Yeah.
just kind of thrown out, and it's like, we'll find housing. I have,
Yeah.
I have family that it's like they are, they cannot find housing right now. There is not housing, even with their budget. So maybe that's why I'm not freaking out at this number.
So Lena, in the last program that we supported, you said the cost per unit was 200. So we were just supporting a portion of the wraparound services that are more like social services, right? Not the actual housing component. Right?
Correct. So we picked off just a portion of the program, and their cost per unit ended up being closer to 200. And we supported, I think at the end of the day, it ended up being 8 individuals. They left a little bit of money on the table, and they spent around $9,000.
But I can't remember, what did they lead with in their application last go around? What did they set a year out, or was it last year?
They sat a
Was it-
year out. Their initial application also had, the application itself was a very high cost per unit. We had discussions with them about picking off just a portion of their program. They were working with other grants that were also very specific. They had one specifically for group therapy that was through UMass, and a couple of other ones. So it was kind of like a puzzle piece situation of where does CDBG fit in? And we ended up funding them for individual case management. And it was monthly. It was a 2-month period, and each individual would have a certain number of check-ins with their case manager, and some, program notes that showed how they progressed over time. In actuality, those people, those young people, tended to have a stay that was much longer in the program, like more like 6 months, 6 to 9 months that they were living there. But we only looked at their involvement with the individual case management component of it.
I wonder why they haven't looked at GRI Health has a youth program that provides vouchers to young teenagers over the age of 18 where they can find like an apartment with a family member and they get an $800 voucher per month for 2 years, consecutive 2 years. That brings the value for the 12 members. That brings it down. That brings it to like 112,000. But that's 12 people versus 2 people who are getting supported, who are not easily housed. To me, that model is much better utilized than someone trying to charge like 40 something thousand, whatever, per 2 person. Just another way of looking at it. And maybe, Greg, that's something that can be thought of as an alternative model where you get more for the buck and still help young people. You're helping 12 people get housed by providing 2 years of support while they become steady.
Okay, so what questions would you guys like to circle back with them on?
I don't know because I mean, can you make those types of changes and suggestions or no? Like, I mean, I
Well,
think
I mean, I can't go making
Yeah.
like programmatic changes or suggestions, but I mean, as it relates to the application, I mean, so I'm trying to remember back. So that was a very new organization. And I gotta admit, I think there was some sort of perhaps some appetite on the part of the city and city officials to kind of fund them because there was already sort of these other organizations they were working with. And my little bit of interaction with them, they are very professional. They know what they're doing in this space, but they're still kind of learning some of the ropes, and they're on their own doing this, right? Like was my whole sense of it. I just know that it wasn't reasonable to support them for all those things and for that amount, and that's why we ended up structuring it more around the service and less of the housing piece, and lowered the cost per unit. So we can certainly do that after the fact too. With this, structure it in a little different way. And we can give them some advice, about, maybe try this funder or that other funder going forward or whatever, this sort of model. But I'm just thinking with are there anything that you guys want clarified from them or from the application, or even from the current expense that they're positing, to come back with you at the next meeting with any sort of answers on that?
Would they be open to doing something with a similar model, right? Where they can do a voucher program where more people will be housed than
Yeah.
not. Like
And
to me,
then-
I think like I do believe that young people do need to be housed and need a place to live. So if they can do like a voucher program with that money, would that be something that Greg, the city will support if they did change it to do something like that?
Well, I mean, the more I learn about how this thing's evolving and how it is very much housing centric, it seems to me like it's more of an ESG type project. So I might talk to Jim Brooks, our Housing Development Division Director, about that. Those are funds that help people with a mix of those things that you're talking about, including, rental assistance and whatnot. So it might be a better fit long run for that program, and then to also explore like the vouchers and other models or avenues. Because I mean, I think it might not be that sustainable, and to only be impacting a few individuals. I think they probably need to go more for like ESG funding. That's Emergency Solutions Grant, and that's more about the things that we're discussing right now as it relates to housing support and stuff.
But otherwise, I'm with Nicole. I think it is an amazing program that can actually support people. I just think that we could do more with leveraging those funds to support more young people, which we know they're unhoused.
I hear you.
Are we done?
I was just gonna say, any other comments about this? So we meet again next week. No, is that?
We make a motion to adjourn our meeting.
Well, let's discuss meeting time just to confirm.
Sure. I
So
have
we're
us,
meeting. Yep.
when we started, I have us in for tonight, the 11th and the 18th, all at 6 p.m. virtually.
Yes. And then do we have a set number of applications we plan to review next week?
I think another 10.
Well, I think we can. I would like to encourage us actually to push that at 12, seeing that we're not going to be spending the time in the beginning. We can get right into it instead of talking about the review sheets and so forth.
Sounds good.
Yeah, we can try that.
Yeah.
So the goal is.
I mean, the goal
So,
technically was that we were gonna end till 7:30. Was gonna be the max, but we did go to
Yeah.
8.
So
So-
one last thing on that last thought, Joel, about the scoring rubric. So again, I left it in your guys's court in terms of if there's any other final tweaks or anything, but that really should be addressed in the context of the meeting. So maybe we just have a placeholder for that at the very beginning. But maybe it's just a 2-minute thing if there's no real substantive changes or anything.
We voted to approve it.
Yeah.
It's
Oh.
approved.
Yeah.
Okay,
Yeah.
awesome. Never mind. I
Yeah,
love it
this
when you
would
guys
be-
vote. I love it when you guys vote to approve things like that.
Yeah, and for clarity,
Well,
I know that some people didn't want to go above 7:30. Is that still the case?
I know my heart out was 8, which I can go a minute or two past. And if we're reviewing 12 applications, next week it would be through application 23 through the Ecotarium application. Just I had to do the math in my head.
I mean, while I do have an
Yes.
appreciation for 90-minute meetings, I also have an appreciation for not, for finishing this on the sooner ends. I just got my my baseball coaching schedule, so there's that as well. Encouraging me to move this along.
Well, Joel, I feel sorry for you, but you committed to us and to us alone. So
I'm working practice schedules around this. So, okay. So let's. I mean, some of these discussions went a full 20 minutes, and some of them didn't. So I would say if everyone can be prepared to come to review through 23, if we're going a full 20 on almost every application, that's going to affect our schedule.
I mean, technically, we only have 8 after that, and we're done. So
Would it make sense to cut it off by topic, like just go through the rest of the services? I don't care one way or the other. I'm just throwing that out there for you all.
say that again, Greg. I'm sorry.
Okay,
like-
let's do that.
So
Yeah.
stop after 21.
Sorry,
Stop
so
at
then it
12.
is going to be 10.
Perfect.
Yeah,
Okay.
that's
I
a
think we're
great
moving-
suggestion, Greg.
We're moving at a good clip, I think.
Yeah, we should be fine. You should be able to, do your thing, Joel, without.
That's an early start to the season. Still snow out there.
That's just my competitive nature.
Uh,
We're doing indoor sessions starting next week.
Oh, okay.
Okay, so through the rest of the services, through application 21, be prepared to discuss that next Wednesday at 6 p.m.
Mhm.
Can I get a motion to adjourn?
Motion to adjourn.
I second the motion.
Thank you. All in favor?
Aye.
Aye.
Opposed? Abstains?
Great conversations, everyone.
All right.
Have a good
Bye-bye.
night.
Motion's
Good
passed.
night,
Thanks,
everyone.
thanks everybody.
Good night.
Bye.